Welcome to today's episode of the Medical Device Marketing Podcast. So today I'm here with Hannah and Oscar. Welcome, Hannah and Oscar.
Hiya.
And we're going to be talking about quite an interesting topic today. I know I say that on every podcast, but everything to do with marketing and medical device is interesting to me.
Accurate.
So interactive video. So this is something that we've really seen is hugely useful to medical device companies to get a large volume of information across in a quick way. So I want to talk about that today so that people can really understand what they need to know about interactive video. What is interactive video? What do they need to know about it to get one started? What do they need to watch out for? And what are the best use cases for it in order to drive your revenue forward? Mm-hmm. So let's start off with what is interactive, just in case anybody doesn't know, because actually it's not used anywhere near as much as I think it could be. Mm-hmm. What is interactive video?
So interactive video is where the watcher chooses their own journey. And it's really exciting because if we're talking about healthcare, every single person that comes to it is slightly different. And the information that they want from a video is different to someone else. So I think in medical devices, video has been used for years, and it may have been used in like instructional guides or IFUs or, promotional material. But actually that's catering to kind of one message. An interactive video is fantastic because, you choose your own journey. And in an IFU, for instance, one clinician over another may have different challenges or different questions they want answering. And it allows that person to get to a piece of information quickly in a really succinct, and it's really smart, kind of way, rather than just a video or, just a PDF of an IFU, for instance.
So practically, how does that actually work? So you can say you can have a huge amount of information in an interactive video, but practically how do people move around an interactive video? Just for people who haven't really seen an interactive video working.
It's a good question. So an interactive video, you generally have somewhere where you start and it's an introduction, but it gives you options. So you get these things called hotspots that will come up on a screen, and they allow you to maybe click it and go to a different point in the video, or it may open up an overlay. It can open up a URL, and it can even work with sort of paid services, and you can purchase through them. So the options really are huge with it, depending on what you want to do with it. That person will then select the button, and it will do the action that you have directed of it. And you can jump all the way. So video off, beforehand was linear. You start at the beginning. You may be able to swipe through. You may have kind of jumps that you can put in, but it's a linear process. Whereas interactive video, I kind of look at it as a bit of a kind of like a piece of like a ball of wool. Like you start at one end and you can jump somewhere into the middle and you come back out, because yes, it takes a lot of organisation and setup, which we're going to talk about in a second about how to get the best out of it. But you're no longer looking at video in a kind of a 2D sphere. It's kind of like that 3D and jumping through and back and forwards and out to a different URL and then back in.
I think also on that, like quite narratively, it's quite beautiful as well. Like sometimes, especially in medical devices, a lot of the consumers and customers and watching this have had their agency taken away from them through an accident, a chronic illness or something, and can be feeling left quite powerless or vulnerable. And actually, I know it's such a subtle thing, but subconsciously having the choice to go, okay, I'm not a passenger in this video. I'm engaging with this video. I'm choosing where to go, can just subtly give you a bit of agency back, which is a nice little thought.
Yeah, I think so. And it's that control, isn't it? If you're a patient or a healthcare professional. Yeah, absolutely.
You mentioned something really interesting earlier. So you said, which I think we brushed over really quickly, but it's something I didn't realize about interactive videos until we started really creating them. What are all the things that you can include? Because when we talk about interactive video, I think about it jumping through the video journey. So, you can customize your journey as you go through, but you also mentioned you can include other things in an interactive video. Can you tell us more about that?
Yeah, of course. So you can include iframes in it, so you can embed any external content. So there, we've recently included IFUs, for instance. Someone clicks on something and something opens up, and that's hosted externally. But you can include video in video. You can put another interactive video in your interactive video.
Conception.
Yeah, I think there is limits. I think it's one-on-one, but there's this whole world of possibility really with it, and I think it's. You can put overlays, you can put timestamps, you can put external links where it opens up another tab. So there's lots of different functionalities with it.
And how customizable is it? Because I might be listening to this and think I might have a really great user case of where I want to use this, but actually how brandable is it? Like, can I make it totally bespoke to me, or is software going to limit what I do?
No, so the interactive platform is an add-on with Vimeo Enterprise that we subscribe to. And once you're in the platform, you've got options to either work with base templates. So if you were talking about a hotspot, the little buttons that do something, there are a range of options that you could use, or you could upload your own artwork file, a CFV file or a GIF. And in that can then become your button. The same for where that then goes to. So if it's like a screen that overlays on the video, that can be fully branded. You can put your hex codes in, you can put font packs in, so this can look completely bespoke. You can even take the little Vimeo button off on the bottom right-hand side. So this then video doesn't look like it's hosted by Vimeo, but it's something that you've really created yourself and own. So there's lots of different customizable things. I mean, as with everything, the platform is evolving, and every time they come up with a new update, they've thought about something else. So prior to now, you couldn't save functions and settings in there, like hotspots and where they go, but you can now. So it's becoming easier and easier to use as more people are doing so.
Yeah. So we talk about sort of, what we can do with it. And what are really great user case examples? So somebody's listening now and thinking, I really like the idea of this, being able to move people through a journey, adding my IFUs into a video, everything's in one nice place. We're always talking about how important video is.
Yeah.
What are some really great user cases where you've seen interactive video work?
Troubleshooting is great. Someone is having an issue. So if I'm a theatre background, so I use that as an example, but you've got a piece of equipment in theatre and it's displaying error codes, for instance, and you could QR code onto the back of it and then be directed to this video and then be asked the question, which error code are you seeing? And then suddenly you get information directly to speak to that particular problem rather than having to go through the booklet or, search online. So I think troubleshooting is a great space where there's lots of different, potentials, and you're trying to navigate, what might be wrong with them. I think instructional guides, whether it's patient or HCP, definitely work well on there. And I think in terms of promotions as well, you could use it as a really nice promotional piece.
That's quite cool, actually.
Yeah.
You really can, and get somebody, because it's something that people aren't really doing. Like, I know we're seeing interactive video in a lot of commerce, but I don't think we're seeing interactive video that much in MedTech.
No.
So there are probably some really interesting areas that we can do that from a promotional standpoint.
Yeah.
I've seen some good uses of like surgeon training of the equipment, and especially when this is going a little bit further afield, but with VR goggles, you can have full-on interactive videos that feel like you are in a surgeon simulation, where actually, a lot of surgeons, we've spoken with surgeons in the past where the first time they've ever, performed a specific operation or had a specific, problem occur during the actual operation. So it's not the first time you want to be exposed to that. So I think the idea of, having a virtual interactive world where you can make mistakes with zero ramifications is a real strong use.
Yeah, training beforehand.
Yeah.
So, okay, so there's some good, we can use it in every area really, MedTech, can't we? It's really about where your imagination can go to how you can use interactive.
And you can imagine it on a stand, can't you? That would be really cool as like something that, someone that interacts with. And, I don't know, there's so many, I mean, you get quite fired up with like all of the potentials, but anywhere that you've got a video, you can make it interactive and you can make it really cool. I mean, it sounds really like basic, doesn't it, to say it like that, but it's just such an easy way of digesting information.
And it's just thinking outside the box.
Yeah.
Everywhere you can do it. So as you say, exhibition sounds, there's so many things we can do.
Yeah.
So that's really cool. Okay, so somebody wants to create an interactive video or work with an agency to create an interactive video, whichever way around. What do they need to think about? Because, Hannah, I'll hand over to you, and Oscar, I'll come to you afterwards. But like, what do they need to think about? Because planning is, and we say that laughing, but planning is absolutely critical.
I think you need to know where every single path is going. So every single option that you give your customer on their kind of journey through this video, you need to understand the ramifications. I was looking on a video the other day and I clicked something and you couldn't get back from it. The only option was to close the whole video itself. So there was an error, and that wasn't one of our videos. It was one online that I was looking at. So it's working out at every point, can I get back from it? And you can do simple things like always having a menu button in the top left-hand corner or a close button or something that brings someone back to the beginning. But you also want to make sure that, the intro, if you've done a 30-second intro to a video, someone's not constantly having to go back to the very beginning, because you want people to engage with it and see the video in all different lights at different times. And, people get frustrated always having to go back to the beginning if they've done one journey and want to go back.
What tools did you use to help you plan out the paths and customer journeys before you even?
It's a good question. So I used Miro. So I started off pen and paper, and quickly, we had a lot that we were doing, and in a recent one I was doing, and it needed to be communicated. This is a big team project, so I work with lots of different disciplines. So we work with the designers to create sort of storyboards for different videos for all of the graphics. I work with accounts directors. We do scripting. The whole thing needs to be very open. So we used Miro in the end. And that meant everybody could have a viewpoint of it. Everyone could comment collaboratively on it and kind of test run kind of where we were going with it. So planning is key. And then the next thing is to do a prototype. So, we're doing a big video at the moment. And what we haven't done is go and start editing it and go live on the whole thing. We're doing one customer journey just to see how that goes, see where the pitfalls are, test the graphics and all of that sort of stuff. And the insights there, you can then make quick, easy updates, save all of the settings, and then apply them throughout other bits of the video.
And actually, even however large or small the project is, following these processes stops you having that problem, as you're talking about wandering into a black hole, where you don't know where your interactive activity is going because you can't remember how to then get back and everything else. So however big or small your interactive video is.
Exactly.
Because actually, the more buttons you have, the more is multiplied out.
Exactly.
So, and you don't probably realise how much it's multiplied out until you map it out on something like Miro.
Yeah.
And I always recommend anything like this. This is equally similar for website, customer journeys and stuff. Have someone else play the role of someone who is trying to access a specific page and see someone who's maybe not familiar, hasn't seen your Miro board yet, and get them to act out that route. And if they can't get there, then there's an issue somewhere.
Yeah, if there's questions, you need to address it up front.
There can't be any grey areas.
No,
there's I'll work this out later.
Yeah.
So planning is absolutely critical if you're going to take on an interactive video. If you're going to do it yourself or if you're going to ask an agency. Really, if you're going to ask an agency to do it, they should be able to map this all out for you so they take the whole weight off you. But it's also, I suppose, understanding that creating an interactive video, they are hugely effective, but they're not a super fast thing to create. Although a small one is not. No, a small one's pretty easy. Yeah. So they can be quite quick to create as well. Yeah. So what are the downfalls of interactive video? What are the limits?
Well, what some bad ones I've noticed in the past, interactive video isn't a new thing in commerce and stuff like this. I've seen a lot recently, but it's certainly very new in medical devices. But I've seen some bad ones where, like Hannah mentions, you get looped back to the beginning, and because the video loop at the beginning is so short, you're hearing the same 2 or 3 word phrase over and over again, and it takes what was, if you think of a normal video, you play it from beginning to end. You're very rarely, unless it's complicated, skipping backwards and backwards and backwards. That can be just take you out of the immersion of the interactive video. So that's certainly something you need to be aware of, that your loops are longer.
Yeah. I'd also say, you can create content quite quickly, just in a normal video, whether you work with a videographer or if you do it in-house. But interactivity requires that, degree of thought of where things are going, where they match up. So it's slightly more complicated. If you're going to get an agency to do it, it will cost more money. So that, that's a downside, as with everything. But I think the upside of it is that it's a really smart product that's fit for a lot of purposes. But I think it can be quite easy, and I'm definitely guilty of getting sucked into the cool features. And it's taking that step back, going, what do I actually need from this? What's the most important thing? Because you don't need to put flashing lights here and all sorts of things. It's we're in medical device, so it's tailoring it to that audience as well.
I think just because it can be interactive doesn't mean it needs to be interactive. So really ask yourself that question. Just because it's a fancy new toy and it's exciting doesn't mean it's necessarily the best method of delivery of your message.
Depending on what you need to do. And what your objective is. Yeah. Lovely. Excellent. So, final question to everybody. What is the one reason you think people should consider interactive video in their marketing plans?
Currently, it's just to stand out. It's just you would be among a very few competition if you are using interactive video. And it's a simple thing to elevate. You don't need to change your messaging. You don't need to change your branding. It's one extra change. A zebra in a bunch of zebras is really boring, but a zebra in front of a bunch of horses is really exciting. So I think let's lean into that and just set yourself apart from your competition.
I really like that.
Yeah, I do. I sound like I can use that one.
You're welcome. It's not mine. I stole it for someone else.
Hannah, what do you think?
I think for me, your messaging has to work with lots of different people. And I think it's a really nice option to have a really succinct piece of content that is appropriate for multiple audiences. And I think that the potential of that is really exciting.
It's a real personalization.
Yeah, absolutely. Yeah.
And that's really exciting because that's what we're seeing in every other area.
Yeah.
That's what AI is driving. That's what we're seeing in email automation, websites. It's all about understanding your audience. Everything is about personalization.
Yeah.
So I think that makes a huge amount of sense. And yeah, I think I think I totally agree with you, Hannah.
Yeah.
Excellent. So thank you very much for watching this episode of the Medical Device Marketing Podcast, and we look forward to seeing you next week. This episode of the Medical Device Marketing Podcast was brought to you by Podymos. If this conversation sparked any new ideas for you, or you want to transform your medical device marketing approach, then our door is always open. Visit www.podymos.com and explore a treasure trove of information about medical device marketing on our Learning Centre. Or, better yet, get in contact with us and speak to one of our expert marketers, as they're as passionate about medical device innovation as you are.